If you want to change the way that your teeth look, especially if you're not happy with the size, the shape, the color, if you try to do a lot of teeth whitening and you're still not happy with the way that your teeth look, then you should consider veneer as a way to take care of all these problems for you. Nowadays, we can make very thin veneer that does not require a lot of teeth removal and preparations, which will provide great aesthetic for a minimum invasive procedure. The first appointment is the consultations appointment. You come in, we'll take a look, we'll do an examination, we'll take photographs, models, and then we set up a second visit where we do a specific mock-up, which is a try-in of what the final veneer is going to look like. If you're happy with the final look of the veneers, then we can set up the third appointment where we go ahead and prepare the teeth, make the impression, give you a temporary, let you go home, and then we work on making your veneers in our in-house lab. You come back a week later, we'll have the veneers ready, and then we go ahead and cement them for you, and then we might see you for one more visit for quick follow-up.